Hi, I'm Shiana Markward, and just a little bit about me, talk a little bit about the profession. Physical therapy is a very well known healthcare profession. However, I don't think a lot of people understand all of the things physical therapists are trained to do and treat, ranging all over the board. PTs treat musculoskeletal pain, pre and post surgery rehabilitation, neurological or cardiovascular symptoms or diagnoses, but also as well as pediatric and women's health. Whatever comes to mind, a lot of physical therapists treat. What I bring to the table is a passion for treating and caring for patients who have pelvic health symptoms. This includes pediatrics, women's health, men's health, geriatrics, neurological deficits. There's a lot of different categories that are encompassed in pelvic health. I've been practicing as a pelvic health physical therapist assistant for 5 years before I was accepted into the DPT program. And I'm excited to continue on this road to become a DPT and to help teach and learn from other healthcare providers along the way. What values, ethics are important to me in my profession? I think healthy growth in all directions. So I believe in honesty and integrity, optimism, joy, and then a community mindset when helping and serving others. I also strongly believe consistency with these values can change an entire culture within one's profession, and then develop a family like mindset and where we work together as if we're a family, helping each other and uplifting each other as we work in and outside of work. What has been my experience with interprofessional work? I have truly been lucky with my experience working with other healthcare professionals. I've worked in acute hospital settings, outpatient orthopedic settings, private practice specialization in women's health, as well as multiple skilled nursing facilities. Each facility has had its own unique communication style when it came to interprofessional work, and fortunately, respect and growth have been emphasized in all of the settings I have been privileged to work in. With that said, I have seen and been a part of many positive interactions and experiences with other healthcare professionals. One experience in particular was in an acute neuro unit where I did a rotation for 12 weeks, and I was able to see firsthand the progress a patient can make simply by healthcare professionals working in tandem and working together. We would have a daily meeting with the medical doctor, social worker, OT, DPT, speech language pathologist, and nurses assigned to a specific patient. And then we would spend up to 2 hours each day discussing as a team specific patients and how we could help them working together. So it was such a good introduction to interprofessional work, and it helped set my foundation. What are your personal values regarding interprofessional work? My personal values when working interprofessionally is respect, listening, kindness, and learning from each other. Have you ever had any experiences where interprofessional collaboration did not go well? If so, what would you change in the future to fix that issue? And yes, absolutely, I have. My experience with barriers when working interprofessionally is almost always a difference in values or sometimes ignorance regarding what other professionals can and cannot do. The hardest part about fixing this is you can't really force anyone professional to change their views or their values. However, you can try to respectfully inform them on what you can do as a professional and how you can work together to help the patient the best that you can. Have you ever had any experiences where your professional values or ethics did not align with those of a colleague? If so, how did you handle this situation? Again, yes, unfortunately. There were multiple incidences in an outpatient clinic I used to work at where another healthcare professional would talk very condescending to other providers or patients who didn't have the same opinions or beliefs that they did. And this provider and I didn't have the same ethical beliefs, and our values differed. So we had a very hard time working with each other with negative experiences, but we were able to work it out in the long run. Just those values and the culture in that setting was important and it didn't align. Last question. Have you ever had any experiences where interprofessional collaboration went well? If so, why do you think things went well? How can you learn from this experience as a future physical therapist? And I have. That experience earlier at the neuro unit was one. But I think when different professionals interact and collaborate, it's a game changer for the workplace and the patients. They can tell when the different healthcare providers get along and work together. I do think things went well with my experiences in the past due to a culture of collaboration, a culture of respect and education and kindness. All of the professionals were focused on a positive, inclusive, and respectful work environment. And then that carried over to how they treated their patients and how their patients progressed to get better overall.